Khubor ka Batisi TV. Lawan Rashapi da ka Orange Nissan Loom So Po near Fabricate Shillong, Ringkat bat ka Victorium, ka Dukan ki Tiar Kilan Met, ka Babhatam Hakador ka Babit, Hannong Thumai Old Beat House Shillong.
Ka Office Jong ka State Tuberculosis Officer Meghalaya menta ka sngi ka arpu artarik unhai leber arajar arpuway kala penlong yang ka jingya mir bat ka jingya thir jingmun halor ka Thong ban rat Dyngkhong na ka benta ban penduk jaj ya ka Jingpang Tuberculosis Shwa jong usnem arajar arpusan lingba ka National Tuberculosis Elimination Program balabo Thong da ka Sorkar Pdeng. Hakani ka jingya mir jingmut ka balalong hanong ba shalong la pentip ru bakan don ru ka jingsam yaki dawai na ka benta ban yada nagani ka Jingpang mat ban penlong ru yaki nong song shnong hagari India baro ka way bakin yo yaka met ka bakoy ka bakhia. Katkum ka jingya tho jongki officer ka State Tuberculosis Officer Meghalaya ki don hadu khat saw tali ki block ki baham hapo kani ka jilla Meghalaya ki balasha pen khamti ban lejwat yaki nong pang na man laki thlew yeng da ka jingit tray lang bat ki nong tray jong ka tanat ka koit ka khia.
This function is to create public awareness about TB. That TB is a curable disease with early diagnosis and treatment, and we want to bring to the right to the grassroots level that there will be no stigma for TB patients. TB germs spread from one person to another through air. It is an airborne infection. If a person suffering from active pulmonary TB cough, spit or sneeze, the germs spread into the air and infects another person. So if the immunity of the person is healthy, he can resist the infection. But if the immunity of the person is low, he will get the infection.
As I mentioned at the beginning, now the program is on a mission mode. National TB Elimination, TB Hariga Desjiteka. We have already started that mission mode. We have started a lot of activities. When it comes to extra effort, we have started something called active case finding. Okay, active case finding means we go to the households. Our staff, our health workers goes to the household to screen for TB patient, and if there is any doubtful case, we do the test and immediately put them on treatment. So that household visits, house to house, like if you remember, we did for immunization. So this is one of the major steps which we call active case finding. That is again very simple, household visits. This is one. Second is that you are involving different stakeholders, multiple. TB is no longer only a health issue now. It has become a social issue. So it's not only that you give the medicine to the TB patient and that will combat the disease. There are other social aspects. The people, the community has to be involved. The family members, the other stakeholders. Like we mentioned, now we have started incentives also, because the TB patients are usually poor, so they need some. We give some money to them, which we call Nikshay Poshon Yojana, NPY, Nikshay Poshon Yojana, that is 500 rupees every month to the patient, though it's a minimum amount, to the TB patient, so that they can, every month, so that they can buy some good food for, and also another incentive called tribal patient incentives, that is 750 rupees. So we give some incentive that is to the TB patient. We also give incentives to people who inform to the program, that they refer to the cases to the program. If there is a TB patient in the community and someone refers and that this becomes a positive case, this is a provision for the incentives for those type of informer also, and also in the private sector. We are trying to involve, because please remember, TB patients are not only coming to the government health facility, they are going to the private health facility also. So we are trying to involve the private health facility also, so that together we can defeat the disease. So these are some incentives, and of course the newer technology. We are trying to adopt new diagnostic technology, okay, which I mentioned again, the new something called CBNAT or TrueNAT, which is a very automatic, very sensitive, specific technology to detect TB. Okay, it's computerized, it's automatic, and it's very fast. So, okay, so previously you used to do microscope, now we are using this new technique called CBNet. So those are some initiatives, and of course the drugs, as I mentioned, good quality drugs. And of course, we are also conducting some research now. In Meghalaya also recently, it is still going on in fact, some survey or kind of research so that further we can improve the program. And we have around 200 annually, every year we have around 200 drug resistant TB cases. But the good thing is that there is some decline. Okay, if you compare to the year 2015, number of cases are coming down to an extent, but again, there are the other factors also. There are drug resistance TB cases coming up, but now it's stable. Even drug resistance TB also in the recent year has slightly come down. But our efforts should be on because we may still have some missing cases. Missing case means those cases we are not being able to detect or diagnose, and they will spread the disease. So ideally, we should be able to detect each and every TB case and put them on treatment. Otherwise, even one cases, if we cannot diagnose or we missed out, that one person can spread the disease to 10 to 12 in 1 year. Okay, so our efforts should be on. Though there is some declination, but we still may have some missing cases. So we should keep on successfully treat around 86 to 87. I mean, in terms of percentage, it is around for Meghalaya. Almost around 87-88% of the total patient we cure. This message should go to the community. And the standard, the quality of diagnosis and treatment is very high. It's of the optimum standard under the National TB Elimination Program. So these messages should go to the community. Otherwise, people will be lost and they won't know where to go. We have identified some cured patient who has fought the disease and come over it, overcome the disease. We call them TB champions. So the National TB Elimination has identified TB champions all over the state of Meghalaya.